Good afternoon, everybody, and welcome to our first fall webinar, the 5 things we wish all teachers knew about school suicide prevention programs, hosted by the Alberta Centre for Injury Control and Research and the Centre for Suicide Prevention. The topic is a little bit different than the promotional materials. Our developers, as they were pulling the content for this, saw things shape up a little bit differently, so we have a slightly different topic, but I'm sure you will find it very useful. So you are all in listen-only mode today, so if you have comments, questions, or resources to share with the rest of the participants, please feel free to use the chat box in the bottom right-hand corner of your screen. I am Patty Stark. I'm with the Alberta Centre for Injury Control and Research, and I'm your host today. But I would like to take this opportunity to introduce our presenter, Linda Skur. Linda is a counseling program supervisor with Adult Addiction Services, Calgary, Addiction and Mental Health within Alberta Health Services. She is also a consulting trainer with the Centre for Suicide Prevention and has been teaching suicide intervention training since 1975. So Linda, take it away.
Okay. Good afternoon and welcome to our first fall webinar. We thought, Patty had suggested it was a little bit of a different direction, and what we had thought to do was, since it's the start of the school year for most, is to begin with a review of best practices in suicide prevention programs in school. I'm sure that you can well appreciate that this topic is huge, and so we're just scratching the surface. We have included a reference list following this webinar if you want to explore it a little bit further, and certainly the issues around this would deserve much more time than we're able to devote to it here. We also know that many of you work in schools and systems that are already implementing these practices and more, which in this case will simply be a review, and in other cases it could be a checklist, and still there might be some other pieces that you might be able to pick up and use as we go along. So the first question we have, or I guess maybe it's a little bit rhetorical, is why schools? Why would we position this information in the school setting? And probably the best answer is that schools offer the best environment to position such programs. The infrastructure is already there, and one of the things that we know about school settings is that young people feel very comfortable. Sorry, we're just having problems with the technology right now. If you can just give me a couple of minutes here. Can you just get this back to where it was?
Where is it?
Get it down, back to where we were? No, before that. It was one before, okay, and then right after. There we go. Thank you. Sorry for the interruption there. We're back on track here. You have the best environment to position such programs. The infrastructure is already there, and you do it well. You also have mostly a captive audience, so to speak, and through providing safe and secure environments for young people, you already set the stage for emotional well-being and growth. Sadly, the reality, I'm sure that you can well appreciate, is that not all young people live in nurturing or caring environments otherwise. Student concerns, whether or not that's academic or learning problems, social issues like relationships and friendships, are much more likely to show up in a school setting because it's a safe place to do so. And I think, if I might, I'm going to invite you to take that as a compliment, because that's what it is. It is to say that if you get more of it in a school setting, if you see students and young people being able to share their pain and distress, and look at it that they do so because, again, it's the environment in which you provide that allows them to do that you support them within that context. So again, take it as a compliment, because it is for many. The other part within school settings is that it offers a number of helpers that might be available to young people, including teachers or counselors, admin, faculty, staff, volunteers, coaches, maybe bus drivers, classmates, in that context. Why would we invite you to incorporate suicide prevention programs into the existing curriculum, such as health and life management classes? Is, again, it speaks to the fact that the curriculum, the infrastructure for these programs is already well established. It's there, it's built upon years of experience and expertise. Certainly studies have shown that rather than isolating certainly a topic like suicide and keeping it isolated, saying, well, it's grade 9, so we better haul out the suicide information and education program, but as an opportunity to provide information all the way through in classes that are related in context, as an opportunity for young people to develop problem solving and coping skills. Suicide is first and foremost a behavior, and in terms of suicide prevention, it is as much about helping people develop problem solving skills and coping skills as a solution to those things. So one of the things that we know happens is that often information about suicide follows, sadly, a tragic event, and it serves again to keep it in isolation. One of the things that we don't want to contribute to is the stigma around suicide. So the more often we're able to put suicide prevention in the context of a problem solving responses as well in a number of different areas in an integrated ongoing way, the more opportunity for young people to develop those skills. The other piece of this, and you certainly may have it, but here's the opportunity to check things out, is what are the policies around suicide prevention in your school setting, policies and practices. Certainly it offers everyone a sense of comfort and confidence in knowing what steps to take, and who are these policies available to. Again, this will include certainly, in many places, teachers, school faculty, volunteers in some cases. The idea is who needs to be on your list. It must certainly include parents and other caregivers in the community. It is universally supported and advocated that providing adequate training in helping school staff develop attitudes, knowledge, and skills necessary to identify at-risk students is an essential and effective component of a suicide prevention program. So, for example, in Calgary, and this may be true in your area as well, there is a teacher at every school system, whether that's separate or public, that has been identified or designated to provide consultation, training, or support to other staff around suicide, and they could be a trained counselor for this, particularly the ASSIST program in suicide as well. So the question would be, is there a designated person in your area, in your school district, or in your school, such as a guidance counselor or school psychologist, to provide information, training, and support staff? And also, what kind of role do you play in working with students, at-risk students? All of the well-written policies and practices in the world are of little value if people do not feel comfortable or confident in implementing them to do so due to a lack of education or training. By far, the focus on supporting staff through education and training to identify at-risk youth and intervene to prevent the immediate risk of death by suicide is cited as the most critical component in suicide prevention programs. One of the other factors, and you may or may not have experienced this, or you may not have this in your school, is the opportunity for peer support programs, student alliance programs sometimes called, to be a part of this program. So what we know about peer support programs is that they allow young people to develop empathy, which is an essential skill, quality in providing much needed support to troubled classmates. There is an important distinction here. Suicide intervention is the work of adults, and yet we also know that the majority of young people at risk tell a peer. So there's also a very important role for peers to play in supporting and advocating for classmates, but being clear about the distinction about whose responsibility it might be. And the role of schools, you would know this better than I do, has certainly evolved considerably over the years. Probably in some areas that you like and you've experienced as very good, and probably no doubt in some areas that you might have experienced as challenging. Schools and the parent or caregiver community need to be on the same page with respect to many issues. Suicide, like bullying, is one of them. Parents and students need to be well informed around all of the issues in consideration of policies and programs that are part of dealing with this particular issue. And lastly, what we're calling the X factor here, and that's you, is that relationship with a significant adult. It certainly might be a teacher, it might be some other adult within the school setting. But research shows that a positive relationship with an adult is one of the most critical factors in preventing student violence, suicide, and bullying, as students need to feel comfortable enough to share potentially dangerous information. That's again going back to the environment that you provide. Here's the bottom line and the best news of all: you don't have to change a thing. Simply by doing what you do and being who you are in a fair, consistent, and respectful manner is the most important factor in any suicide prevention program. You'll never know the difference you make. And how many minutes was that? A good 8? I didn't.
Do you want to mention the references?
Okay, Linda, thank you. So at this point, you can see there are some references listed on the screen. Those will be available as well as the recorded webinar. Do we have any questions or discussion or sharing of experience that anybody would like to indicate in the chat box now? Have people found useful resources? Do you have school policies?
Some stuff coming in.
Okay,
There might be other people.
I don't. Okay, do I put it in there? Okay. I don't type. Okay.
Oh, but no. So we've got a comment about interest in the resiliency program in Red Deer. Do you guys know about that?
I can speak to resiliency as a general program. One of the things, well, resiliency is not a new program, but certainly it was one that was certainly enhanced upon, let's say by ADAC in particular, before we became part of the larger health services system. And one of the things that we know about resiliency is that there are ways that, I mean, some people simply acquire some skills in being able to roll with the punches, but we understand that certainly we can help people learn, and some of these behaviors and abilities can certainly be learned through approaches that support individuals in managing and having practice in dealing with situations. So resiliency is certainly a big part of what we use in terms of health information as well, particularly in helping young people deal with problems related to basic life skills, information on alcohol and drug use, for example, managing those situations when things get a little bit tight.
Thanks, Linda. And I see we have Whitney Ireland on the webinar as well, who indicates she's a resiliency coach in Red Deer. So, Whitney, I know John's asking some questions now. I'm wondering maybe if you could provide some information to me that I could forward out to people after the webinar, or if you've got a link that you could suggest people could go to, that would be great as well.
So,
we had another question too about how often a person should have training in suicide intervention. Linda?
well, I guess, how long a person should have. I mean, I guess I might be not reading this question properly, but we would look at certainly the programs of suicide that are offered here through the province have their own expiry date. And so we would say we take the 2-day program and your best before date is 3 years from that. So if that's kind of meant as an opportunity to keep current with the information. So how often? Certainly within the 3 years, we would recommend that people have an opportunity to review existing information and any new information coming up. And there are opportunities to do that through taking the 2-day program again, or what we would describe as the tune-up, which buys another couple of years in between there. So I don't know if I've answered that properly, and I may have misunderstood the question, but the idea is, and it's a good one, the question is a thoughtful one about maintaining current knowledge and awareness.
Okay, we've got lots of dialogue going on about sources of information about the resiliency program in Red Deer. Now let's see. So suggestions. Okay, you answered right. So that one was answered. Okay. Any other questions for Linda or the rest of the Center for Suicide Prevention team?
I'm going to invite my colleagues here to speak to this one. I might have some information on it, but as I said, I will invite them to contribute. The question is a policy for assist teams at the school level?
That was the question.
Okay. Is that something that you can speak to, or how it's implemented in the schools? The policy for assist teams at the school level?
I think but teachers are required to have it.
We're still responding. Okay.
Hi, I'm Dave McLeod. I'm one of the people that's part of this team. The question, as I understand it, is somebody's asking about what are some policies for assist within school systems. I can tell you what the Calgary one is. In Calgary, and it's the board that made this decision, that every school should have at least one person on staff who is trained in the full 2-day assist workshop. And then many schools, some of the bigger ones, the high schools that have 1,500 students or more, might have 6 or half a dozen people in the school. And the idea is that any teacher, whether they have no training or no awareness or anything of suicide, if they hear something that's concerning, then they have access to somebody right within the school to be able to do that. When Linda was talking earlier, she mentioned that might be a luxury that a big urban center like Calgary could have, that maybe a smaller rural area might not be able to do. But if there are at least some people within the community, even if they're outside of the boundaries of the school, but available nearby, it's always useful to know who in your community might have some
Okay, thank you. Are there any more questions? I'll just give it a minute. I think there's a few people typing. Oh, thank you. Any other questions for Linda and the rest of the Center for Suicide Prevention team? Okay, I think that might be it today. I don't see any more questions. So if that's the case, I'd like to thank Linda and the rest of the Center for Suicide Prevention team for a great presentation today, and we had a fair bit of discussion too, which is wonderful. Thank you for your participation today. We will be sending out a link for both the recording and the survey. We ask that you take a few minutes to provide feedback in the survey so that we can use that information to inform future webinars, but also to seek additional funding